This is Kurt. He was using a circular saw blade. It slipped up his forearm.
How are you doing in terms of pain?
It's bad.
Pain's bad. I'm worried that when we take that tourniquet off, he's going to start bleeding rapidly. We've got the mat pack ready.
Oh, yeah, man.
The nerves are freaking out because they're not getting blood supply.
We don't have much time left to save his arm. Just keep looking to me.
Please, just get rid of the pain.
In the ED, emergency Dr. Jonathan Papson shares an office with an unofficial collection of old medical curiosities.
These are the educational artefacts. Over the years, we accumulate bits and pieces. An eye. Oops, spare eyeball in case you need it. I've been around long enough that these things are familiar to me and I've seen them in use. Used to use paddles. They were good because you could just put them on and give someone a shock, but then they discovered that the pads are probably better. Some of the old stuff worked pretty fine. One day we'll get a nice big glass cabinet or museum piece. Maybe they'll put me in there too.
On the rooftop, Dr. Jonathan's next patient, a young woman, is being choppered in after a serious car accident.
I'll probably do this trauma.
Yeah.
We're about to receive a 19-year-old who's been in a motor vehicle accident where the cars slid, spun and hit a tree. So it's a side impact which can be more dangerous than frontal impacts because there's less protection in the side of the car. G'day. So it's leg injury.
Sounds like it's just primary. Work it on, slide you over. You won't fall, okay? You just stay nice and still. Don't try and help us or anything.
What's your name?
Harriet.
I'm Hannah. I'm one of the nurses.
Hi,
going to be looking after you, okay? You right?
Yeah.
Nice deep breath, okay? 1, 2, 3. Doing all right?
Yeah.
Are you ready to give us the story?
She's the driver of a late model small SUV going down a dirt road about 60 kilometres an hour. She's lost control, spun 90 degrees, hitting a big tree.
Lateral impact thing.
Yeah, right on the driver's side door.
Broke the leg.
Pretty much.
Yeah.
She was trapped for about an hour and a half, just trying to get her leg out from the car.
And the leg is femur fracture? Or,
right. So it's right and swollen. And
Yeah.
So there's no pertinent airbags on the vehicle.
No airbags. That means she's had no protection from the side, so the injuries are going to be worse. Hello.
Hey, how's it going?
I'm all right. How are you?
Oh, I'm okay.
You've had better days. My name's Jonathan, one of the specialists. Sounds like you've probably got a broken leg from all this.
Oh, joy.
Yeah. I'm worried she's got a broken femur. It's such a big bone. It's your thigh, and you can bleed a lot into a thigh bone. So dangerous stuff. And it looks like you bruised your face too. You got blood everywhere, but you had a blood nose too. You sore in your face and your mouth?
No.
No. Pretty frightening. On the dirt road, yeah? Yeah.
Ariane was taking some time out from her busy job in civil construction to help out a mate with his cattle. She'd just left the property when her car spun out of control.
I was lucky enough someone that was just travelling down the dirt road saw me and obviously noticed that I couldn't get out. I can't remember what happened once I saw the tree.
Were you by yourself?
Yeah, thank God.
Emergency nurse Hannah Wong has seen many young patients in this frightening situation.
Who do you live with?
My mum and dad.
Yeah, and they know that you're here in hospital?
Yeah.
Even though she seems calm on the surface, I think Ariane is feeling quite scared. She doesn't live in Melbourne and she's only 19. I remember when I was 19, I probably would have just wanted a hug from mum or dad.
Take some big breaths.
Ariane's father Clint and mother Tanya faced a horrendous scene.
We pulled up about 50 metres from the accident and myself and my wife started running up to the car and there's a lady holding my daughter's head in her hands. You could see the blood from her nose and the blood coming out of her ears. And until we got right up next to the car, I didn't even know if she was going to be alive.
Now, your right leg looks pretty swollen up. Are you sore in here?
Yeah.
Yeah. Often people break their femur bone in there, and that's probably what you've done. How's your knee? Is that sore?
Yeah.
It is, yeah. I'm worried about the amount of swelling because that can only really swell up through bleeding and blood loss. So you can lose quite a lot of blood into that compartment of the leg. Are you sore here?
Underneath, yeah, a bit more, yeah.
So I look at her face and she's bruised, and I'm worried that she's got a broken cheek and a broken nose and that her face has hit something. See, you got a black eye. Sometimes people just crack the bone there. You might have done that. The skull is a very complex bone structure. I'm worried she's got multiple fractures there. Just open your mouth up. Yeah. And your teeth feel okay? Yeah. So where'd all the blood come from? There's a lot of blood. I am worried that there's something we're missing. Where'd that blood come from?
Emergency Registrar Dr. David Sparkle is taking extra care as he starts his shift.
I'm about 190 centimetres tall, which occasionally leads to issues. Taking out my head on that way too many times. And it draws amusement from the rest of the team I'm working with whenever I inevitably take my head out on something.
As soon as he hits the ED floor, Dr. David's first case is on the way. A badly injured man is being rushed in by ambulance.
Did you get through to the surgeons at all?
I'm coming.
Nice, thanks. We've got a young man coming in. Don't know a huge amount at the moment, but what we do know is concerning. He's injured himself with a secular saw to his arm and is coming in with a tourniquet on to stop bleeding. I think we should probably get some pressors ready, just a bit of metaraminol, lines for access.
Expecting a severe injury, Dr. David prepares his team.
Potentially think about intubation for pain control, maybe, depending on how he is or if he's really delirious. We'll get ketamine if we need it. This patient could have some serious bleeding. He's most likely is cut through an artery, and it could progress to being life-threatening, and we'll need to basically throw the kitchen sink at him to keep him stable.
For such a potentially serious trauma, Dr. David makes sure he has all the support he needs.
Basically shocked with a tourniquet on, so may need theatre. In these trauma calls, we get in a lot of different specialists depending on which part of the body's been injured and what we think might need to be repaired. Having them down makes my job a lot easier.
Paramedics have arrived with 39-year-old Kurt, a self-employed handyman who was carving a piece of wood when his arm slipped and was sliced open by the saw blade.
So do you guys want to get him across and then we'll do handover? If you're happy to do the primary survey or with Tom, do you want to get some extra access if that's all right? All right, mate, there's going to be a lot of people buzzing around you, checking a lot of things, and then we'll give you a bit of an update once we've made sure everything's safe. That's all right? Cool.
Everyone's set, ready to go, ready, set, go. So this is Kurt. He was using a circular saw blade. It slipped and has tracked obliquely up the anterior aspect of his left forearm.
Are you happy if I put a cannula in this arm as well?
Yeah.
Oh, we've got 2 18s.
There was ongoing hemorrhaging that required a tourniquet to bring it under control.
Is that tourniquet still on now?
The tourniquet is still on there now. That was put on at 14:30.
14:30.
Yeah, no worries.
Can you pull some bloods for me when you do that one?
Tourniquets are a last-ditch life-saving measure. By cutting off the blood supply to that region of the body, you stop any more blood loss. But cutting off that blood supply means that those tissues will start to die after time. Kurt's had this tourniquet on almost an hour now, so we don't have a lot of time before that tissue starts to be damaged permanently.
It's killing me, like burning.
So it's a tourniquet. You know when you tie like a rubber band around your finger, that sort of thing? That's the pain.
Well, when I
But that pain is better than having...
belt and wrap it around my arm.
Yeah, perfect.
But I just grabbed it and I ran across the road.
Yeah, I mean, you did everything right.
When the accident happened, Kurt, desperate for help, ran to his neighbours who called the ambulance. His partner Chantal knows they saved his life.
I could see the blood out the front across the road, up their driveway into their doorstep. If it wasn't for the neighbour, I don't know what would have happened. He could have bled to death. Kurt was here by himself.
The pain's going to keep going. We take it off as quickly as we can. But we just don't want to make sure we release it and it spurts out blood everywhere.
How are you doing in terms of pain?
Pain's bad.
Pain's bad. Kurt's in a lot of pain. The tourniquet itself can be very painful as those cells start to release the distress markers from not getting enough oxygen.
Fingers are burning,
Yeah.
my thumbs are burning.
The nerves are freaking out because they're not getting blood supply.
So bad, man.
Fearing Kurt may have severed an artery, the team try to manage the pain caused by the extreme tightness of the tourniquet.
We're just getting you some strong painkillers, all right? Can we get a bit more fentanyl?
50 fentanyl?
Yeah.
I'll grab it.
Normally, I want to have a look at the wound without the tourniquet on, but controlling the bleeding is very, very important. I'm worried that when we take this tourniquet off, the bleeding is going to start again. We could end up with a quite rapid deterioration. We are just getting everything ready in case it deteriorates when we take the tourniquet down.
Dr. David and the team are treating 39-year-old handyman Kurt after the circular saw he was using sliced into his arm as he was carving a piece of wood.
We're just getting...
Worse than before.
Yeah, often the initial shock takes away some of the pain.
Burning and throbbing and burning at the same time.
They need to get his extreme pain under control before they can X-ray and see just how badly damaged his arm is.
Can you knock me out? Something
We'll-
just like seriously, man.
Yeah. We're going to make you feel a bit spacey.
Please.
Yeah.
Just get rid of the pain.
Keeping on top of that pain is my top priority at the moment. Gigi, are you free to get us a quick bit of ketamine out of the cupboard just in case we need some for examination? Yeah. Thanks. Yeah. Circular saws can tear through muscle, nerves, blood vessels, or even break some bones. Because of that rotational force, they can cause much larger wounds than you'd expect.
Put the board under your arm. Alex, someone support your elbow.
There you go. All right. Yeah, I'm just trying to lift my arm up. Where?
We're looking at this X-ray for any signs that his bones have been broken. Just gonna hop out for the X-ray. And for any signs that bits of the circular saw have broken off and been left embedded in the wound.
Well, I use my hands all the time.
As a handyman, the results of this X-ray could have long-lasting consequences for Kurt.
His arms are his life, like his hands, they're his tools. He loves to build and make things. If he has lost any movement or possibly a hand, that's going to be a difficult part.
They're looking good. It looks like he hasn't broken any bones. It's always a relief when there's one less thing that you have to deal with. All right, guys, we'll just take a minute, guys, to summarize this.
With such a large team assembled, Dr. David needs to make sure everyone is up to speed with next steps.
Next priority is going to make sure we are prepared for any deterioration for when we examine that arm. Okay, and we've got the met pack ready. Can we get it up and ready to attach just in case? Yeah. And we've got aramine as well?
Yeah.
Okay.
As they prepare to take the bandage down, the team is expecting the worst.
I'm happy for you to start taking it down. We just got everything ready. If you need more painkillers, we'll give you more painkillers. If it starts bleeding a lot, we'll put some more blood in. We'll take good care of you, all right? Got all the equipment you need? Do you want gowns and stuff in case it is? But give us a shout if you need some more painkillers, because we've got some more here.
Can't feel it.
We're just taking the bandage down at the moment, so don't worry too much.
As the plastics team get their first look at Kurt's arm,
Just keep looking to me.
Oh, fuck, I didn't feel burning.
what they see is horrendous.
What's that got to be? Radial artery?
100%. The radial artery is one of the two major blood vessels that supply the hand, coming down from the arm. He's cut through it.
Oh, you fucker, man. What are you doing?
The bleeding has started again.
We're just trying to stop the bleeding.
Bloody hell, please squeezing the shit.
It's very clear that bleeding is not under control.
Oh.
Let's have a proper look at you. So where'd all the blood come from?
Dr. Jonathan and Nurse Hannah are treating 19-year-old Ariane, whose car slammed into a tree on a deserted dirt road.
She's got some lacerations around her finger on the other hand,
Yeah,
and she's got a small lap on the side.
yeah.
The team is worried she has a badly broken leg and a possible skull fracture.
Does that blood come from your hands, maybe?
Her nose.
Yeah, my nose, yeah.
But it's blood loss that they're most concerned about.
You've got lots of dried blood in your nose and face.
She's got signs that would fit with a fractured base of skull. When we see fluid coming out of someone's ear or nose, then we're worried about a fractured skull and a breach in one of those membranes that wrap around the brain. I'm just going to ultrasound your chest.
As Dr. Jonathan quickly does an ultrasound, he's aware that Ariane's head slammed into the car door on impact.
Do you remember much about what happened?
I remember the side of the car going towards the tree.
Yeah,
After that, I must have been gone for a bit, I think.
you reckon? Yeah. What I'm trying to gauge is how bad her head injury is. Did she just black out for a second because she closed her eyes when she hit the tree, or does she actually just not remember a large chunk of time? Because that would be a marker of a head injury or a brain injury. How long do you reckon you were out to it for?
I couldn't tell you.
Would it have been a long time? Like, 10 minutes, 20 minutes? It's worrying that she doesn't remember a period of time in the accident. We need to test for concussion or other brain injuries. So that's why a CT scan is so important.
But before they can take Ariane to CT, Dr. Jonathan wants to see how badly damaged her leg is.
We're going to get a scan and an x-ray of your leg, because that's the leg's your problem.
Just doing an x-ray of your chest, okay? Yeah. Take a deep breath in now. Hold your breath.
So we don't see a fracture. Great, good, all right, that's good. I'm not seeing a fracture in your leg, so that's good. So it might just be that you've got a really bad cork thigh, so you've got a big bruise in the muscle. It's not fractured, but she's still really sore. So she's got swelling and injury to the muscles around the bone, but not the bone itself. I think it looks all right, but we're still going to scan all the other bits and pieces. Bones can be fixed and bones will heal. But she's had a blow to her head and brain, and those injuries are a different story altogether. People can have a head injury, seemingly be okay for a few hours, and then they can slip into a coma. We're not out of the woods yet.
Dr. Jonathan is waiting for a detailed scan report on 19-year-old Ariane, who blacked out after her car smashed into a tree.
So now the scans are all done.
Any head injury can be devastating, and obviously a young person is really devastating if it's going to affect your quality of life, your ability to do the things you want to do.
Today's accident has put a stop to Ariane's plans.
We're meant to be going to holidays, but things don't always go the way you want it to, unfortunately. Live and learn a bit, wait and see what everything comes back with, and go from there now.
Dr. Jonathan now has the scan results.
I'm just having a skim through to see whether she's actually got a brain injury from the impact. We usually start off just having a look at the brain, because that's more important than the bones. The scan of her head doesn't show a brain hemorrhage or a significant brain bruise. Then, if we get to a view of the bones, looking front on, there's a bit of air where it shouldn't be. These black bits should not be there. Black air. Break the bone and the air gets in, and there's a little bit of air there. We can see air in the wrong spot. You shouldn't see air inside someone's head. She does have some skull fractures, but most people with skull fractures don't actually need anything. The bones will heal by themselves.
Bruised. Really bruised on.
Finally, Ariane's parents have made it to the hospital after travelling from country Victoria to be with her.
I think that door got pushed all the way in. The door got pushed right in on your dog.
I can't believe we're in the shape of it.
Ariane's lucky to survive this crash, really. It's a high-speed crash in an old car into a tree. So many times we see people who don't make it. She's lucky she's out of here with the injuries she has. We're going to keep an eye on her. We'll keep her in overnight.
For now, Ariane will go to a ward and remain under close observation.
You guys just follow behind us.
Even though there may not be anything to operate on, she's going to have some problems with her head and the injuries associated there. It may take quite a while for those injuries to heal and for things to get back to the way they were before she had the crash.
Emergency Registrar Dr. Tristan Harding likes to get his step count up before starting a busy shift.
I usually walk just to get some exercise in. Good way to keep fit. Shifts are generally about 10 hours from start to finish, and you never know if you're going to get a break, so you just got to get some fresh air while you can. Can I check the one that I was going to take, the trauma alert? Because they were originally for trauma too. They're going somewhere else now, do you know?
Recess 5.
Dr. Tristan's first patient is landing on the rooftop.
Got a patient coming in, aged in his 60s. He's fallen off a roof and hit the ground via a garden bed, so he's got some significant cuts, particularly to his head. There's potential for a serious brain injury or a spinal injury as well.
67-year-old Andrew has 13 grandchildren and was helping family with repairs at home when he fell head first.
You lie nice and still and we'll do all the work, okay?
He's putting up some railing on a roof this morning. That he's leant over the railing, falling forwards. Believes he's sort of hit his head on some trees and bushes sort of coming down. Fall was approximately 3 metres. Family members are on scene straight away.
Andrew's family live in the country and are now on their way to the ED.
He sustained a massive laceration to that right side of his head with an avulsion, and that's completely come off to about the ear.
With an avulsion, part of the scalp is sheared off the bone, and we've got the bone on view. There's a potential here for a lot of blood loss from this wound. Andrew, how's your pain at the moment?
Oh, it's a bit sore on that side.
If you need pain relief, let us know.
With a fall of 3 metres, Dr. Tristan checks how well Andrew remembers the accident.
Can you tell me what happened today?
The rail just gave way and went down.
And did you go head first into the ground?
Yeah, head first.
Yeah.
I put my hands out.
Yep.
It might have been the branches and they cut my head. I'm not so sure.
Yeah, sure, okay. So what was below? You had some branches, some bushes and trees and stuff?
Yeah, it was a garden bed.
Garden bed, yep, okay, no worries.
I hit that.
Even though Andrew's fall was broken by the bushes below, Dr. Tristan is concerned for spinal injury.
Just to check, are you able to wriggle your toes for me?
No, can't wriggle my toes or ankles.
This is all just since it's happened today?
No, since I've had my back surgery.
Back surgery, okay. It certainly throws a spanner in the works with his previous back surgery because I need to make sure that his current level of function is the same as what it was prior to the fall.
I walk with a crutch.
Just a stick?
Yeah, just one crutch, just so I've got balance.
I'm just going to do a quick top-to-toe exam. Quickly shine a light into your eyes. Good. So pupils are 3 millimetres, equal and reactive. Any pain when you take a deep breath?
No.
No. Let's get you to squeeze my hand for me. Good. So pulses ×4, both feet are warm.
Andrew's initial assessment is clear, but it's his head wound that now needs urgent attention.
We'll take down your dressing on your head and look at the wound.
Yeah.
At the moment, your pain is getting worse.
No, it's just a throbbing pain at the front.
Yeah, all right.
Oh, and the sides here.
Yeah.
Knowing that part of Andrew's scalp has been sheared off, Dr. Tristan has called in trauma Dr. Megan Emerson for backup.
Big head wound, bilateral shoulders are sore, so I wanted CT pan scan plus the shoulders. We've got the whole team together to look at the wound in one go because we're not sure what we're going to see underneath.
So someone came and found you?
So we need to be prepared for everything. Fuck, man.
Okay.
Like, seriously?
We just need to make sure that that bleeding stops so that you're not unsafe until we can get the operation to fix you, okay?
Okay.
Oh.
In the trauma bay, Dr. David and the plastics team are trying to stop the bleeding in 39-year-old Kurt's arm after a main artery was severed when he was using a circular saw.
There's still a leak down the bottom. Deep breaths, deep breaths. He's still bleeding. We're going to need to apply a second tourniquet. Having a second tourniquet doesn't restart the timer. The blood supply has been mostly cut off for the arm by that first tourniquet. The arm has not had enough blood supply and the cells are struggling. So we do need to get him to the operating theatre as quickly as possible. The clock is ticking on that arm.
Sorry, it's going to be a little bit uncomfortable.
Keep taking those deep breaths for me. We'll get you through.
Looks like that second one has stopped there.
Yeah, looks good.
Plastic surgery registrar Dr. Nayan Bindi can now explain what's ahead for Kurt.
You've got nerves, blood vessels, and tendons that are all damaged, okay?
Ah,
So
seriously, man.
this is going to require multiple hours for an operation to get it all fixed.
Yeah.
Worst case scenario that I'm worried about is the fact that the blood supply going to your hand right now is not good. So that's why we're trying to get you to the operating theatre as soon as possible.
This won't be a simple operation for the plastic surgeons. Well done, guys. With those injuries, it's almost certain Kurt is going to lose some degree of function in his arm. The surgeons will do their best to reattach the nerves and the tendons and the muscles. They'll need to painstakingly repair one by one, but that's no guarantee of success. So he's going to go to Theatre 13. As someone that works with his hands, this is a potentially life-changing injury for Kurt. I can only hope things go well for him.
In the hope of saving Kurt's arm, the surgery team is taking him straight to theatre. Dr. Tristan is about to see just how bad the head wound is of retired shopfitter Andrew, who fell 3 metres head first off a balcony, crashing into a garden bed.
We're going to take down your dressing on your head and it could get a bit sore.
Dr. Tristan knows the wound could be horrific.
All right. Okay. This is a very deep wound. He's literally ripped off his entire scalp down to the bone. I can see his skull bone sitting right there.
Oh, sorry, mate.
Just giving you a bit of pain relief now, okay?
Yeah.
Might be a bit stingy, mate, okay?
Having seen the wound is full of dirt, Dr. Megan must quickly start the painful cleaning procedure.
You're the boss. If it's too sore, you tell us to stop. Just trying to get as much of the muck out so that it prevents infection, okay?
Yep. The main aim at the moment is to try and reduce as much of the infection risk as possible and remove all that debris as best we can.
Is that pain relief working? Not sure. Nope.
Are we giving the 50? Give another 25, yeah. That pain relief kicked in?
Oh, kind of.
A little bit.
I still feel a bit of it.
Keep doing those big breaths, that's helping.
As Dr. Megan continues to clean out the wound, the team can't believe what they're seeing.
A whole lot of debris in his head, including branches like this. I've never seen anything like this being removed from a wound before. It's not often we get a patient brought in with this much debris still in an open wound. There's twigs, there's leaves, there's even mud in his scalp wound. If it's getting worse or you need more pain relief, let us know. Out of 10, what is it at the moment?
About a 9.
Just give the other 50, Jamie. Make it 100 in total.
Emergency nurse Jamie Bullock is on hand to help.
I can see he's getting really uncomfortable. His pain score's increasing. Given the depth of the wound, how big the wound is, it's really important that we treat his pain.
It works pretty quickly, so you keep taking those nice deep breaths like you are.
Yep.
The team has removed as much debris as possible from Andrew's head.
Need a bigger crate, I think.
That is too small, I agree, yeah.
I'll get my hand underneath the whole thing, so you're okay. You just rest your head down.
That's the way, mate. Well done.
With the wound safely bandaged, Dr. Tristan updates Andrew.
Wound on the head's quite decent. It'll need to have an operation to fix it. You okay? Lot to deal with, eh?
Yeah.
You're in good hands. The next step is to do some imaging with a CT to look for other injuries on the inside, whether there's a skull fracture, and to make sure there's no bleeding on the brain. Bleeding on the brain could be catastrophic for Andrew with long-term consequences.
One, 2, 3, 1, 2, 3.
67-year-old grandfather Andrew is having an urgent CT scan. The team is worried he could have brain or spinal damage after falling 3 metres head first from a balcony. As Andrew is being scanned, his granddaughter Silk arrives after an anxious 2-hour train journey.
I've got such a great connection and relationship with my pop. I've got a really big soft spot, so hearing that he got into a bad accident, it was terrifying. I was borderline thinking he was gonna like pass me, and I was scared, very scared. I just want to be there for him.
Silk has been living with her grandfather for the past year.
Hi, Pop.
Anyway,
I brought you some stuff, for later.
there's dinner like enough.
No, don't worry about dinner.
But it's going to be eaten.
Yeah, okay, I'll tell Blake to eat it.
The relationship between Andrew and his granddaughter is such a beautiful relationship, very cheeky, and I can see that Andrew's fear and anxiety is so much better having her here.
And how's your pain?
It's not too bad.
Yeah? Whereabouts is the pain, would you say? Still in your head? Yeah.
And just like tingling in your shoulders.
Yeah.
Given the nature of Andrew's fall, it's really important to frequently be checking Andrew's neurological state. I've seen a patient's neurological state change very quickly, specifically if there is a significant bleed in someone's brain.
What's going on?
Oh, hi, Mike.
Andrew has a second visitor, grandson Blake, with an offer of help for next time.
Where do guys do things? Check the garage.
Too old, man. Can't be climbing walls.
Yeah, but I only knew how to do what I was doing.
I could have Googled it.
Yeah.
It's fine.
Wouldn't have done it.
Check out the cats and such.
Yeah.
I'll let Mum know too.
All right. Why we going so far?
Dr. Tristan can finally give Andrew some good news.
Hey, Andrew, apart from the big wound on your head, you've avoided any other major injuries. So, this collar on your neck we can take off.
Yeah.
We can sit you up, and we can let you have something to eat and drink. We're not going to do an operation on the head until tomorrow morning. CT scan results have come back showing there's no serious spinal cord injury, no serious fractures in the neck, and more importantly, there's no bleeding on the brain. It's not very often you get a patient who's fallen 3 metres who is lucky, as Andrew is, to be awake and talking despite his significant wound. Let's sit you up. Bed's still coming up, okay? How's that?
Yeah, that's fine.
The next steps is to take him up to theatre to clean out this wound and to re-stitch it as best we can. The plastic surgeons will come and see you at some point to discuss the plan for operating on your head to put that skin back together. I'll get everything organised for you to go upstairs, and I'll take care of you up there. All the best.
Thank you.
Thank you, Andrew.
Thank you.
Cheers.
Before moving upstairs, Andrew has some last instructions for his granddaughter.
I expect the house to be clean when I get home.
Oh, shit. But I'm glad you're okay, and everything's okay.
I suspect this will be a long and slow recovery for Andrew. It's been a significant fall, a really nasty wound, and if Andrew's grandchildren have anything to say about it, I don't think he'll be getting up on a roof anytime soon.
Many agree that breakfast is the most important meal of the day. But amongst the ED doctors, there's a dispute over what's best.
How do you all have your avocado in the morning?
So, not at all. Not at all.
I have mine with sourdough toast, salt and pepper.
Never touch
Delicious.
the stuff. Vegemite on toast is still the best breakfast.
No protein.
No, it's great.
Don't like Vegemite. Stick with my coffee.
But Dr. Emma's coffee will have to wait, as her next patient has already been brought into the ED after a breakfast mishap of her own.
I've just left your bag up here with a heads up.
I need it. I'm
Oh, you need
looking
contact
for the
us?
credit card. Do you have to pay? You don't have Medicare? No.
The patient is 31-year-old Winona, an international student from the
At
Philippines.
7:40 this morning, Nona has removed a knife from the dishwasher. Has tried to remove the seed from an avocado.
Yeah.
She's missed the avocado. She's gone in through the front of the hand and out the back.
Oh, dear.
It was an unserrated knife, about 7 centimetres long. We've definitely
Okay.
to the other side.
Oh, you poor thing.
It's pretty nasty. She's gone to stab the avocado seed and it's really been driven through her entire hand. So there's potentially some nasty injuries underneath that we can't see: tendons, nerves, vessels, muscles.
So I'm Emma. How do you say your first name?
Winona.
Winona. Beautiful. Yes, I was about to say.
Winona juggles her studies with work as an accountant and being mum to her 5-year-old son.
So you're making avocado toast?
My husband always takes avocado in the morning. He's been with 2 jobs.
Yeah.
So he needs a healthy breakfast.
Yes. You don't know the trick, that one, where you pull it out that way. You went that way.
I was still so sleepy this
Oh.
morning. When I tried to stab it, I tried to make it go deeper, and then it just slipped and went right through my hand.
Oh, jeepers.
And then when it went right around, I was like, oh, pulled it out.
She's pulled it straight back out. So the process of going through the hand or it being removed can sever a tendon, you can sever a nerve or a vessel, and there could be bleeding.
And you have a child?
Yes,
Yeah.
I have a 5-year-old.
5-year-old. And your 5-year-old's at home with your husband?
With my husband.
Okay, very good.
Despite her serious hand injury, all Winona's concerned about is how she'll pay for her treatment.
Are you worried about the money? Oh, Winona.
It's really hard financially for student visa holders and with a son.
I'm so sorry. Do you mind if I have a look?
Dr. Emma is about to see the stab wound in 31-year-old Winona's hand.
Is your pain okay?
Yeah.
After the knife she was using to remove an avocado seed slipped and went right through.
Okay.
Okay.
There you go. And
you're gonna get a picture.
You can get a picture, and I'm going to get a picture, but mine's for your medical record. On the other side. Well, that's gone through, hasn't it?
Wow.
It's a big, sharp knife that's gone in one side, out the other, and then been pulled out. So it would be a miracle if she hasn't hit something significant, because there's heaps of structures just traversing through the palm of the hand. Any one of those could be injured. So what are you studying?
Masters of Professional Accounting.
How do you do that with a child?
With a child and with work, because I also work.
Oh, what work do you do? Are you working in...
As an accountant.
Are you?
Dr. Emma checks if Winona has any loss of sensation.
Can you feel me touching you on the inside and outside?
Yeah, I do.
I'm examining her fingers, their movements, and also feeling could there be a broken bone, making sure I detect any injury that might be there. I'll get you to turn over and you can feel me touching you in there.
Yeah.
Can you straighten your hands? Good. Despite that knife having gone through all those important structures, there doesn't appear to be any other injury. Her tendons are working well, the blood supply is good, she can feel everything. It's absolutely amazing. I'm going to bandage it all back up again. She's going to need that cleaned out. There's the risk that she's got partial injury to a tendon or a nerve, and so that's going to need to be closely explored by our plastic surgeons. When they do an operation, they'll explore to make sure that your tendons are okay. Alrighty, done. Now, if it bleeds, let us know, but we'll just put pressure on it and hold it up. I'm going to speak with the plastic surgeons and I'll let you know their plan. Okay, nice to meet you.
Nice to meet you too. Yeah.
I think Winona will be hesitant having avocado again, and certainly I'll be thinking of her next time I open my next avocado for Bricky.
Nice deep breath, okay? You're doing all right.
19-year-old Ariane's car spun out of control and slammed sideways into a tree on a deserted road.
So where'd all the blood come from?
She was airlifted to the ED with a suspected broken leg and head injuries.
Looks like you bruised your face too. You got blood everywhere.
After multiple scans, Ariane escaped with only a badly bruised thigh, but sustained serious head injuries.
These black bits should not be there. You shouldn't see air inside someone's head.
Four months later, Ariane is doing well after a lengthy recovery period.
Get Zach out again for a ride. Be good to have him out there again.
Been back at work for a few months. Good boy. Walk for mum. I had a fracture over my temporal lobe and I broke the top of my jaw on my right side, fractured my sternum and did an AC joint across the back of my shoulder. Scrapes and bruises everywhere else. I was lucky enough I didn't actually have to have any surgeries.
Apart from one remaining symptom, Ariane's feeling positive.
Overall now I'm pretty good. I'm a bit deaf in my left side, but other than that I'm pretty much back to normal now.
And happy to be back doing everything she loves.
I'm very lucky to be here. Life could be pretty short if that's the way things go. I get to keep experiencing new things life has to offer. Yeah.
You lie nice and still.
Grandfather of 13, Andrew, fell headfirst off a rooftop balcony into a garden bed.
He sustained a massive laceration to that right side of his head, and that's completely come off to about the ear.
He suffered a very severe wound that cut all the way to his skull bone.
We're going to take down your dressing on your head and it could get a bit sore.
Oh. Sorry, mate.
The team was amazed by what was embedded in the wound.
A whole lot of debris in his head, including branches like this.
Andrew left the ED to have an operation where plastic surgeons successfully stitched up his head, and he was sent home 2 days later.
There you go.
Winona accidentally stabbed herself with a kitchen knife while preparing an avocado for breakfast.
Well, that's gone through, hasn't it?
Wow.
Although she had a nasty wound, the knife missed all major bones, tendons and nerves.
You can feel me touching you in there.
Yeah.
After an operation to clean and stitch the wound, Winona still has full use of her hand and continues to prepare avocado for breakfast every morning.
All right, mate, there's going to be a lot of people buzzing around you checking a lot of things.
39-year-old handyman Kurt sliced a main artery in his arm with a circular saw as he was carving a piece of wood.
Fingers are burning, thumbs are burning.
If it starts bleeding a lot, we'll put some more blood in.
To stop the bleeding, the team needed to put on another tourniquet, but were worried they wouldn't be able to save his arm.
We need to make sure that that bleeding stops. The arm has not had enough blood supply and the cells are struggling.
Kurt was rushed to surgery for an emergency operation. 4 months later, Kurt is still recovering from the traumatic accident.
The injury started from there, ran all the way around and up my arm. The accident impacted my life hugely. I struggle with everything. I can't hold things, I can't grip things.
Kurt has endured multiple surgeries and rehab.
I had to cut down the centre of the palm of my hand. They stitched my 3 tendons, they were shot.
Despite a slow recovery, Kurt is philosophical about the future.
It happened, and I can't change that. But what I can change is the way I do things, the way I look at things. You know, it gives you a different perspective on life.
Well, we'll just get there slowly. And then we'll